Lee. It's not the typical request I get, but I always try to accommodate the public will. Thank you for coming. Our first speaker is Dr. Lynn Perry, who Senator Polk has been nice enough to locate for us. I understand that Dr. Perry is available by Zoom, although I'm never quite sure how that works. But Senator Polk, would you want to mention how it came about that we have Dr. Perry with us, and then maybe we could hear from her and you could make sure she covers the matters you wanted to cover.
Thank you, Mr. Chairman. Ladies and gentlemen of the committee, Dr. Perry came to my attention after our last meeting, and we heard from the Mississippi Medical Association, and they were adamantly opposed to passing a medical marijuana bill. It dawned on me that maybe we should talk to those who have had experience with it. And of course, Colorado's had very much experience. They've had their law many, many years. And so I called their medical society and found Dr. Perry, and also was introduced to a Dr. Finn. And they, after talking with them, I felt that maybe if we heard from them, we could see what pitfalls and snake pits they got into, and possibly what could be done to make Mississippi's law a better law if we could hear from them. So I talked to Dr. Perry. She agreed. She is a neurologist in Colorado. You have her bio information. You can see she knows her subject very well. And so at this time, I'd like, Mr. Chairman, if it's okay for Dr. Perry to take over.
Absolutely. And Dr. Perry, assuming you can hear us, thank you. We appreciate your time.
Thank you very much. Can you hear me? Okay. As long as you can hear me, I will just blab until you tell me to stop. I'm Dr. Lynn Perry. I'm an adult neurologist in Denver, and I have been practicing for a very long time, and I am at the age where I'm not going to tell you how long that is. But we have been dealing with medical marijuana since the year 2000 and recreational marijuana since 2012. The medical society, our medical society initially was neutral about something that actually never went through the legislature. It was a ballot initiative. But we have remained actively involved because from our standpoint, it is very difficult to get reliable research on the benefits of a substance that does not go through the normal process of the medications that we normally use, which is the FDA process of specific amounts and dosages and toxicity and prospective studies. Since it's still federally illegal, though that kind of research has been very difficult to obtain. Nonetheless, society makes its own decisions about what they want, and we as physicians have to treat people. And we already have a historic experience with trying to prevent people from drinking alcohol, which was not successful, except that during Prohibition, the amount of cirrhosis and liver disease plummeted to levels which we have never seen since that was overturned. So that's just a little historical reminder. What I did want to talk about is things that we got right in Colorado and things that that weren't right enough. So when medical marijuana was established, we did say it should be only authorized, since it's not a medical product, we can't prescribe it, and it can't be, we can't write a prescription and have it filled at a pharmacy because that would be against federal law. But we restricted it initially to only physicians, that it was somebody who had an MD or DO, and They had to have a license that was not restricted, and they had to have a DEA license as well. And we required that they have a bona fide physician-patient relationship. We thought that was a pretty good start. We limited the age of for authorization to 21, and if you were under 21, you had to have 2 physicians authorize for obtaining a card. Then recreational marijuana came, and I naively thought, oh, everybody will have access, medical marijuana will go away, and I can just tell people they shouldn't be smoking. That is not the case. And we still have medical marijuana, and actually we had more problems from that. So several things have happened in that period of time. Marijuana is no longer the marijuana we knew as kids. This is no longer the marijuana where you as a dad or your dad comes in and finds you, that you have a weed or a joint stuck in your algebra book. It used to be that those products had 15% THC, which is the active tetrahydrocannabinol, is the active hallucinogenic product component. Now plants can carry up to 40% THC, and we have concentrates that are being marketed up to 90%. And those are creating very significant and very different problems. What we're seeing in Colorado now, and we just passed new legislation to address this, is we're seeing damage to during pregnancy with poor outcomes in terms of low birth weight. We're seeing adolescents and kids far more frequently in the emergency room with psychotic episodes, with hyperemesis, where they have intractable vomiting that really isn't responding to almost anything. We're seeing kids dropping out of school, not achieving their goals. And this is a huge problem. We have limited resources to address these issues, but the things that can be done and that we're trying to put in place now is the ability to track real time to prevent looping. I don't know whether people know what looping is, but looping happened in Colorado as the amount of really toxic substances in terms of high concentrated marijuana became available. Kids who were between the ages of 18 and 20, which is really not a regulated area, would go to would take their card, they would get a small amount, and once that transaction was finished, that was erased from it wasn't tracked so that they could then go to the place across the street and get another amount, and then go down the block to another dispensary and get more. And then they would take it back to their high school and distribute it to their friends or sell it. Often they would just share it, so that we had a fairly extensive distribution problem in terms of exposing even younger kids to pretty potent configurations of THC. The types of things that we're really, and the other problem that we're having is our pain doctors who would be seeing somebody for management of their in my case, neuropathic pain, or somebody else for low back pain, they would say, have you used marijuana? Oh yeah, I have a card. Well, who authorized the card? I don't remember, the doctor. Well, I'd like to get their records. Well, even when we found who the records were from, and call them, and they'd say, oh, we don't keep records, we just do the cards. That's not medical practice. And so one of the things that I would advise anybody considering creating legislation for medical marijuana is, if you're going to treat it as a medicine, as a medical product, then treat it as a medical product and follow all of the guidelines and rules that we follow in medicine, which is you keep records, you document what you see, you make a diagnosis, you prescribe a medication that's appropriate for the patient and for the diagnosis. I would no more write a prescription for a patient for pain that says 30 pain pills and give it to a patient and expect the pharmacist to decide what narcotic or anti-inflammatory or whatever they're going to give to the patient who is not their patient. But that's what has happened. So I think that we have tried to, we were strong supporters of our recent bill in Colorado, which actually requires people who authorize medical marijuana that they have to have a diagnosis and they have to provide the limit of, if not the concentration limit, the total amount. And the law now limits no more than 2 grams a day for any medical marijuana product. So I think putting in very strict guidelines is important. We did set up, one of the things we set up early was medical marijuana registry. I think most states have done that. It certainly should have more power and more ability to track information in real time. But this is a growing industry. It makes a lot of money. It does a lot of lobbying. And our concern from a medical standpoint is protecting particularly our youth, our children, and our adolescents. People under 21, THC affects the developing brain and can significantly and permanently retard its ability to grow. And you don't want that for any of your kids. I think I've sort of hit the high points, and I'm not sure what you're all going to do with this information, but we have a lot of experience, some of it helpful, a lot of it we thought we were putting guardrails into place and they weren't sufficient, and we have a lot of people who have been harmed in Colorado. And hopefully if you decide to go this route, you can find ways to protect both our women who are having kids and our children or our grandchildren. Thank you.
Thank you. And again, we appreciate your time and your willingness to talk with us. If you don't mind, I think several of us have some questions. And you mentioned guardrails. And I wondered if you could sort of just quickly list some of the guardrails that you think would be most important in a medical marijuana bill.
I think the most important are making there. I would say there. I've thought about this. The 3 would be concentration or amount limits. Absolutely, particularly for medical marijuana. That most states don't think about this until after the barn doors have open, and you can't, it's not something you can retrofit. We're trying to, but it's been very difficult. I think the other areas are as I said, treating it as a medical product, requiring documentation the way you would from any medical provider. And we have expanded it to more people who have a DEA license, dentists and AP, advanced practice nurses and physician assistants. But I think if you start out just limiting it to physicians, you have one medical board that can take responsibility for people who do not practice ethically. And I think that you can set the amount of visits that people have to make sure that somebody is monitoring them if they're authorizing its use. I think that the ability to, the other kinds of guardrails is requiring disclosure in dispensaries as well as from authorizing treaters about the potential harms, recognizing toxicity, and we have a requirement that requires medical dispensaries to at least have visual notices that marijuana is harmful for pregnant women. Unfortunately, it's not required in the recreational facilities, but it should be. Those kinds of things, the notice of harms if you're offering something that people see as beneficial. And continued public education. One of the distressing pieces that we've seen in Colorado is that each year when they do the review of substance use, it includes a perception of what is a risky behavior. And among children ages 12 to 18 and the 18 to 24 group, every year the perception that marijuana is a risky substance goes down. And although we can't state that, in Colorado it's been so obvious that it coincided with medical marijuana, that there's this belief that if it has a medical use, how could it be harmful? My grandpa's taking it for his back pain. It's a safe product. And we know that's absolutely not true, and not true for children. So I think those are some of the things that you can do.
Thank you. Senator Polk, did you have questions or comments?
I do have a question. Thank you, Mr. Chairman. Thank you, Dr. Perry. Appreciate you being here today. One of the things that I think we talked about was the maturity and growth of a child's brain. And if we are, let's say, prescribing it for a child, I think in one of our conversations you said that unless that child has no other alternative and possibly has no forward life neurologically, so to speak, that there needs to be other alternatives besides medical marijuana. I'm not sure that's clear of what I'm trying to ask, but it seems like that unless a child is absolutely severely in pain with no other alternative because of their youth, their brain is not fully developed yet, and that should be maybe the last use. Would you explain that just a little bit?
So, so what we have found out is that in childhood, most of the use of cannabis is for seizures, more so than for pain. There is still a very little understanding, I think, among the public that where cannabinoids have been shown to be helpful for seizures is with cannabidiol. which is a hemp product. And there actually is now an FDA approved product for the treatment of those childhood epilepsies. There's a big difference between the CBD, the cannabidiol, and THC, the psychoactive part of cannabis. So that's certainly an area that can be, that requires a lot of education, both of physicians and of the public, and probably restrictions in terms of when it's appropriate to use that. You need it's the disparity between sort of public belief and medical knowledge is pretty large in this arena. You do depend on your medical communities to be appropriately educated as to what is valid and what is not helpful. So there are several states, including ours, that we will start, that require education in this area before they become able to authorize its use. I don't know
Senator
if
Blackwell.
that answered your question or not, but.
Yes, thank you. Senator Blackwell.
Thank you, Mr. Chairman. Dr. Perry, appreciate you taking the time to give testimony to us. You mentioned the limiting the THC level, and I imagine that's in edibles that you're referring to.
So there are concentrates besides edibles that can be made for people to vape. Dabbing is, I think, illegal, but people still do it, which is getting concentrated oils or amounts that they can then find ways to inhale. And the problem with that is if those concentrations are high, one inhalation will give you a very high concentration, and that can be toxic.
If you were to set a limit on per dose, and I guess I'm going to refer to more edibles and consumables in this matter, what sort of milligrammage does Colorado, do they have something in place? If not, what would be your thoughts on that?
Well, so the other countries who've been dealing with this have limited to 15% THC in any product. I don't know whether that is possible to do, but certainly far less than 50% THC in any product, whether it's a concentrate or a consumable, a gummy bear. 15% is the standard in European countries that they limit to.
Senator Tate. Yes.
Question?
Yes.
Thank you. Doctor, I think I have two questions. One, how is, and I may use the term incorrectly, but caps in terms of distribution in Colorado, how is that done? Or are there?
Limits, we're still trying to get a handle on that. So we just passed legislation that will limit the amount in terms of grams that are allowable per day for medical marijuana. The biggest difficulty that Colorado has had is any kind of enforcement.
Doctor, I'm sorry. I think what I was referring to was licenses to distribute medical marijuana.
Licenses for authorization.
Yes.
So that is right now limited to it was recently expanded. You have to have a license under your appropriate board as a dentist, under the Board of Nursing for an advanced practice nurse, or under the medical board for a physician assistant or a physician, a MD or DO. In good standing, that means without restriction, and you have to have a DEA license. The number of people who actually authorize is not large, and and from the very beginning, and is still true, the majority of authorizations are a very small group of people who are a very small group of providers who are most likely that is all they do.
All they do is prescribe marijuana.
They will have a marijuana practice.
Okay, thank you.
Thank you. Dr. Perry, we appreciate very much your being with us. We know that you had other things you could be doing, but this is very helpful to us. Thank you for your time. My understanding is that the temperatures in Denver are higher than they used to be. So you may be closing in on those of us in Mississippi on temperature, but I'll bet we've got you beat on humidity. So anytime you feel a shortage of humidity, please come down here. We've got some to share with you.
Oh no, thank you. I grew up in Southern California, and I love living in the desert. So my daughter was lived in Missouri for 5 years, and I visited her there a lot. And you are more than welcome to all the moisture in the air that you have.
Thank you very much. Thank you for your time. Do we have Mr. Brisboe set up on Zoom? Do I do anything, or does he just magically appear? We have with us the executive director of the Marijuana Regulatory Agency from Michigan, Andrew Brisboe. Senator Blackwell located him. And so, Senator Blackwell, do you want to introduce him? And
Sure. Thank you, Mr. Chairman. Mr. Brisboe is the executive director of the Marijuana Regulatory Agency in the state of Michigan. He took over this position in March and heads a department of over 100 employees. His role is to be the impartial head regulator of the statewide recreational marijuana market approved by Michigan voters in 2018. So, Mr. Brisboe, if you're on, you may begin.
Well, good afternoon, everyone, and thank you for the invitation. I'm always happy to appear and speak on behalf of the state of Michigan and what we have going on here. And it's I have a few things to say about humidity as well, but I can save those comments for later on. This concept of regulating marijuana in this space is always a challenging one. And what I found in my experience is relying on other states' experiences is critical to informing perspectives and understanding best decisions when it comes to implementing regulatory programs for both medical and adult use marijuana. And our agency in Michigan oversees all facets of marijuana registry and regulation in the state. We manage our patient caregiver registry, and we license medical facilities and adult use establishments within our agency. And Michigan's story is followed a pattern of some other states, but I think it's important for context to understand sort of where we are and some of the challenges we face in our state. We've had legalized use for medicinal purposes in the state since 2008, but from 2008 to 2016, that was on the basis of a patient caregiver registry. Qualifying patients have to have a certified medical condition by a physician in our state, and then they're allowed to utilize marijuana for medicinal purposes. and they can designate a caregiver to grow plants and assist with the administration of that on their behalf. And for 8 years, that was the only program we had. There was sort of a commercial element that was born of that out of an absence of enforcement, and in some cases, even where businesses were forming with municipal authorization. And in 2016, we had a legislatively enacted law that required the agency that I now oversee to license facilities that grow, process, sell, transport, and test marijuana from the medicinal perspective. And then in 2018, we had a ballot initiative that passed that sort of performed both of those functions in the adult use space, provided for personal use and home grow allowances, and also created a regulatory system that we now oversee with a number of different license types there. So one of the main challenges we faced was transitioning from this illicit market that exists probably in every state in the country, but we also had a fairly robust unregulated system that was in place as well, that was supplying the needs of many of the patients in the state, and had to figure out how to make that transition artfully without leaving patients without access, while also implementing the laws as they were written. So in the last several years, we've seen tremendous growth. Most of the licenses we issue are for either growers or for retail locations, but we do have a number of other licenses in other spaces. We have a tiered licensing system for growers in both the medical and adult use space, with growers of class A, B, and C in both markets, with slightly different plant count numbers that are allowed under those licenses. On the medical side, those are counts of either 500, 1,000, or 1,500. On the adult use side, plant counts of 100, 500, and 2,000. And then in the adult use market, we also have a micro business license that allows the business to grow 150 plants, but it has to be vertically integrated. So they do all their own processing and have to sell only those products that they produce. We have 4 of those licenses that have been issued in the state out of almost 800 licenses in the adult use space that we have now. And we have over 1,000 medical licenses issued as well. We do have municipal control in the state as well. State licensure is essentially predicated on authorization at the local level of the business. And we have 156 municipalities in Michigan out of 1,773 that have authorizing medical ordinances, and 106 out of 1,773 that have authorizing adult use ordinances. So still the vast majority of municipalities in the state that do not allow for commercial facilities in either the medical or adult use space. We have a 10% excise tax on adult use products. That's in addition to our 6% sales tax. We do not have an excise tax on medical products. We used to have a 3% tax, but that was automatically repealed with the passage of the ballot initiative that legalized adult use in the state. Just to give you some sense of the growth of the industry, a little over a year in, we saw during the pandemic a doubling of the total market about every 4 months last year. And in this fiscal year, which will end in September, we expect to be at about $1.5 billion in total sales between the medical and adult use markets in the state of Michigan. And that's happening at the same time we're seeing retail prices decline dramatically. Over the past 12 months, the retail price in the adult use market has dropped 47% and dropped 20% in the medical retail market. That's largely due to an increase in the supply that's coming through the regulated space. In the initial phases of implementing our regulatory program on the medical side, we did allow for products produced by registered caregivers to be infused into the regulated market through our growers and processors. That was phased out in September of 2020. So now we are completely reliant on the supply that's produced in the regulated space by the growers. And in terms of the number of plants that are being grown within the regulated space, we've also seen a tremendous increase over the past several years. So now we have about 135,000 plants that are harvested per month in the regulated market. And in terms of the plants being grown, we have about 850,000 plants that are covered by our growers that are currently licensed in the state. We do allow for multiple Class C grow licenses, that largest grow license in both the medical and the adult use side, to be held within a single location. We do not limit the number of licenses they can have at a single location. So some of our largest grow operators have over 20 licenses that they house within the singular facility. That method of having plant count that dictates the size of the operation, I think was something that was put in place in 2016 just for the ease of tracking. I can't say that that is the most effective mechanism if you wish to control and have oversight over the size of a grow operation, because there's no standard output from a singular plant. And even how plants are defined as the program has become somewhat contentious. At what point we start counting the growth of a plant as hitting against that cap based on the size of the license issued. So there may be other ways to consider, and some other states have taken different approaches of determining the size of a grow operation, either by their mass output or the square footage of the facility, the canopy space as they call it in some other states. So growing the number of plants obviously makes it very easy to interpret the size of an operation, but isn't an absolute measure of the size of a facility. So hopefully that gives you a little bit of insights into the program, and I'm happy to take any questions any of you might have as to the Michigan experience in this space.
Well, again, thank you for your time. I always hate to predict what the legislature will do, but it's my opinion it's fairly likely that Mississippi will enact some version of a medical marijuana statute. I think it's unlikely that we will adopt an adult use statute, but it may be the case that whatever medical marijuana statute we pass morphs into an adult use situation. But I think that's a fair summary of where we are. Given that that's where we are, what advice do you have for us? What would be the things that you would think we should be most careful about? And what are the biggest things we need to worry about if we're drafting legislation?
That sounds like a similar trajectory that many other states have taken as well. Based on that experience, I think the best guidance is to just, if you are intending to pursue any form of legalization for medicinal use, it's reasonable to assume that that will morph into adult use at some point, and to consider that ultimate transition in for the purposes of planning how you regulate the market and what it looks like, because it sort of becomes almost inevitable that things trend in that direction. And as it currently stands, the operation in this space is obviously strained by the fact that marijuana is still a controlled substance at the federal level and remains illegal. So considerations for how businesses will operate is certainly a consideration. Access to banking and tax structures within the state can be greatly challenged by federal restrictions. At our level, we engaged in some services to provide to financial institutions so that they could help address the issues on the federal level and provide banking services. So the industry, the commercial industry, wasn't completely reliant upon cash. Obviously, that creates a number of public safety concerns if the businesses, not just retail transactions, but even business to business transactions are happening almost completely in cash. I think as Dr. Perry mentioned in the comments of hers that I saw, access by youth and unintended consumers is always of primary concern as well, and how issues of preventing youth access will be done is certainly in consideration. One of the things that we're focusing on in Michigan now, coming out of the pandemic, as we return to more normalized operations and get our folks who do field inspections and investigations back out in the field, is focusing on reining some of those issues in, where packaging and labeling and product availability starts to resemble other commercially available products that can be confusing to adult consumers, let alone young people who might not pay close attention to those products, even when they're very tightly controlled in terms of sales. Once they're lawfully sold to a consumer and they're taken back home, there needs to be some consideration given to what the products and packaging look like, so as to deter access by young people. the testing standards for products is something that I think Michigan has been very strict on to ensure the safest possible access. That can be very challenging in the absence of recognized standards. You'll see disparate testing standards and a patchwork of regulations throughout the states that have legalized access. There isn't a great deal of consistency with what is tested for and the levels to which things are tested. I think it's very important to involve scientists in the evaluation of those standards and determining exactly what's to be imposed. And then I would echo some of the comments that Dr. Perry made as well when it comes to public health surveillance data. The Michigan program did not proactively devote a lot of resources to public health surveillance, baseline data gathering, and then follow-up studies being done to see what the impacts might be. That makes it very hard to inform policymakers as to changes that might be necessary to ensure that we're protecting public health, safety, and welfare when you don't have that data on hand. So I think those are some high-level key components to consider in implementation.
Senator Blackwell.
Thank you, Mr. Chairman. Mr. Brisboe, again, thank you for taking the time to provide us with testimony. I'm curious, when you talked about your micro business, why did you make them all vertically integrated?
So because this was an initiated law, it's very challenging to dig into the why behind its design. The language that was presented in the ballot initiative was passed by 63% of the voters, and the agency then is left to implement it as written. And unlike with a legislatively enacted law, we don't have a history, we don't have analysis documents to look at legislative intent. So we're sort of left with what it is. In speaking with some of the folks who were promoting the ballot initiative, the best sense I got is this was done to provide for a small business opportunity, something that would be a lower barrier to entry, lower cost of entry, so that a smaller business could have an opportunity to compete with some of the large vertically integrated operators without the requirement to get those 3 separate licenses as a grower, a processor, and then a retail location. And in particular, in Michigan, a caregiver, if they are providing those services for 5 patients and are a patient themselves, can grow up to 72 plants. So I think it was intended to try and take some of those folks who were pushing the boundaries of what a caregiver was intended to do under our 2008 Act and provide a pathway into the commercial market for them and a legal commercial operation. That obviously we've not seen a lot of that transition. We still have over 30,000 caregivers in the state and only 4 micro business operations. But with that business type, I think some of the constraints that were put in our statute make it challenging. I've heard from some individuals who are pursuing that opportunity that growing 150 plants does not provide enough biomass to have a consistent inventory of products so that you can compete with other businesses that have access to the wholesale inventory that's available throughout the market. And the concerns that if you happen to have one bad crop that doesn't work, you might be out of business because you don't have the ability to supplement your inventory through any other means. Those are concerns we are trying to address in a license type that is proposed in our administrative rules package that is going through the process now, trying to mitigate some of those concerns. The other piece of it with that mandatorily vertically integrated model that makes it challenging is municipalities, I think, struggle with where these businesses should be located. Traditionally, you would not have an agricultural or manufacturing operation in a retail zone, and you wouldn't typically put a retail operation in an industrial or agricultural zone. Well, now we have a business that operates on all 3 of those fronts, and it can be you figure out exactly where they should be. So I think the intent was good to provide a carve out for small business opportunities. We also have that grower A license, which allows them to grow up to 100 plants. We have 3 of those active in the state as well. So I think with the ability for some of those smaller growers to continue to operate in the gray market and still be profitable, the market just hasn't incentivized them to make that transition as of yet.
Would it be reasonable if you were to legislate this to allow just somebody to do a micro cultivator and maybe have a dispensary without having to be a processor? And as far as processing, they would use another third party?
That would certainly address one of the concerns that was raised to us in a work group that was discussing various opportunities for more equitable ownership in the industry. The cost of processing equipment and manufacturing marijuana infused products was identified as one of the leading challenges to making that business model successful. And as I said before, what we've heard from those who are in the know in the industry is that to attract consumers, you have to have a variety of products. And so you may have the skills to be a good grower. And if you have 150 plants, you can produce a few strains of flower that might attract consumers. But if you don't have the other products that are available on other retail shelves in the state, it's going to be very hard to be competitive.
I think you mentioned that some of these folks have multiple licenses, I guess, at the cultivator level. Is that because of the plant limitation that you have? And if so, are there penalties if somebody goes over that limit? And lastly, what are your thoughts on just a canopy versus plant?
We do have a number of larger growers that have a significant number of licenses whose focus is on the wholesale side, which I think for market stability is important. We need to have businesses that focus on producing for the purposes of wholesale supply, because we have a number of independent retail operators who are not producing their own supply in some of our more highly populated areas where we would encourage consumers to utilize the regulated market for access. In the end, it's turned into somewhat of an arbitrary measure of the size of a business. They do obtain multiple licenses. There could be penalties for exceeding plant count, but with the growth cycles in these facilities, more often than not, they are not utilizing their full plant count at any given time. They don't typically grow straight to that capacity because they have crops that are turning over on a regular basis. So they always have some plants that are in the cloning stage, in the early stages of growth where we're not requiring them to be individually tagged yet, or they're in the harvesting stage where they're being taken down as plants and packaged into flour or other types of products for movement through the supply chain. I don't, as I said, I think if I had it to start all over again, I'm not sure plant count is while it may be the simplest measure of the size of the operation, it does require grower licensees in Michigan to have multiple licenses where a processor can bring in as much wholesale flour as they want and produce as many products as they want at any given time, having one license. And so I think measuring for the purposes of tax allocation or relative control of the size of the business, some other measure of output, whether that's canopy space or by weight of wholesale product moved, is probably a smarter measure of the size of the operation for consistency's sake.
Okay.
Thank you, Mr. Chairman. Mr. Brisboe, is there a residency requirement for, let's just say, the state of Michigan, and whether it's micro grows or Class A or Class B or the various classes that you've mentioned? Is there a requirement that so many percentage of Michigan residents are awarded those licenses?
There was some language both on the medical and adult use side for certain licenses that required an individual who was applying to be a Michigan resident. However, that language was not very articulate as to how to handle a business entity. And almost every applicant that we have is a business entity, not an individual natural person. And residency of a business is harder to measure. So in essence, practically speaking, not had a residency requirement. And Michigan also does not have state level caps on licensure. Municipalities may have individual caps. So we've avoided any concerns about imposing residency as a requirement for licensure, and haven't had to deal at the state level, at least, with trying to encourage a certain percentage of licensees to be residents either or any other type of criteria, because we are specifically prohibited from putting those caps in place. But having been obviously in tune with what's happened at the municipal level, where there have been residency requirements imposed for eligibility or carve outs for local residents in those circumstances, that's almost always led to legal challenges, holding up the process, and ultimately, in most cases, unfavorable rulings for the governmental entities that have tried to impose those restrictions.
Yeah. And one further question, I'm sorry. How does Michigan regulate medicinal marijuana getting into the black market? Are plants tagged? And if a plant is found to be molded or for whatever reason, is it destroyed and that recorded? I think some constituents may have a concern about that happening, and I'm just curious as to how Michigan handles that.
We do have robust track and trace requirements. So all regulated businesses are required to use the statewide monitoring system. Our statewide monitoring system is Metric. It's an IT platform, and all licensees are required to input all inventory, transactions, personnel, transfers, whether they be business to business or business to customer transactions, are all within that statewide monitoring system. They are allowed to use third-party systems to integrate their data into the statewide monitoring system, but it all has to be there. And yes, anytime a plant is destroyed, it has to be tracked in that system as well. Waste has to be rendered unrecognizable and unusable before it leaves a facility. So there's very tight controls deliberately intended to prevent diversion out of the regulated market. But practically speaking, diversion from the regulated market to the illicit market is generally speaking not a concern. The cost of getting a license, the value of having that license, and the potential profitability of a business is not worth that risk. More so what we see in a market that is not yet at maturity is a risk of inverting illicit market products into the regulated market in order to make those sales at what have been the higher price point, the regulated space. In more mature states where there's a tremendous amount of surplus production in areas where the environment is more conducive to outdoor cultivation, I think you're more likely to see that. We do see, in terms of illicit operation, in states where there's safe harbor, so in Michigan where it's legal to grow at home and you're less likely to face severe legal penalties, even if you're growing outside the boundaries of the law, there's an economic opportunity to export products to other states that do not have legalized frameworks as of yet, where the prices are still very high. But we don't see a lot of nexus between licensed operations and that. We see truly illicit market operations utilizing Michigan's fairly liberal home grow allowances as an opportunity to grow without a lot of risk and ship to other states.
Senator
Thank you.
Senator Blackwell.
Thank you, Mr. Chairman. Just one more question. There are a number of states that have agencies that regulate their both medicinal and adult use programs. Can you maybe help us understand the benefit of having such an agency, some of the tasks that your employees perform, and if you don't mind, share your budget number with us?
Sure. So from my experience, I think it's been very beneficial to have all of our efforts in terms of setting policy, administrative policy, working with policymakers on new laws and new concepts, and establishing the regulatory environment, all housed within one agency. As it stands now, marijuana policy and marijuana oversight is sort of not analogous to many other things. And having various pieces of that program housed in various departments or agencies, I think presents a lot of challenges. That being said, the expertise that's necessary to appropriately oversee this market is also varied and challenging to obtain within a singular agency. So we view our agency less as the be all end all when it comes to marijuana policy and regulation, and more as the hub of the wheel that then reaches into other agencies to borrow expertise and get insight on specific areas where we need help. Areas like public health, the oversight of infused edible products, and implementing food safety standards for marijuana infused products that do not meet the legal definition of food. Cooperating with our environmental partners on pesticide issues, for example. So building in all that internal expertise to one agency would be very, very hard. As our agency has grown, we've started to build some of that in, but certainly as we were building it out, relied on other partners to help us understand key technical issues and develop standards that were reasonable. Our agency budget, if you give me a moment, I'll pull it up. We do have a budget that's approved specifically for our 3 program areas. So for the registry program, for the adult use regulatory program, and for the medical registry program, the executive recommendations for the upcoming fiscal year included an appropriation for our agency of about $9.9 million for our registry program. That's about $5 million in operational costs. We also have grant funding requirements that come out of that. Grants we send to county public health agencies for educational components. About $13 million in direct appropriation to our agency for the medical regulatory program, and about $8 million direct to our agency for oversight. But we also have some other state agencies that have direct responsibilities that are appropriated funds as well. Our Department of State Police has an investigative section that splits their time about 70% to tobacco tax enforcement and about 30% to marijuana enforcement, and they're appropriated about $9 million, so that includes some other incidental costs as well. And our Department of Treasury is also appropriated about $4.6 million for implementing and overseeing the tax registration and tax collection processes. Though that allocation, I think, is a bit high because the program is new and they needed to set up the IT systems for the tax collection as well.
I think I saw a flurry of hands over at this table. Did I see a flurry? Only one hand, but it looked to be a flurry. Okay.
Thank you, Mr. Chairman. In response to the chairman's question about if you had to do it again, you're about the 5th person that we've heard from that said if it started out as medical and it's inevitably going to end up as an adult use program. What are the forces that are driving that has driven that if it's inevitable that we should be looking for?
I think that's been varied state by state, but I think you'll see that pattern unfolding in every state. That you tend to end up with a medical registry first, then commercial medical, and then commercial adult use following not too far behind that. In Michigan, I think that was largely born of an opportunity to collect tax revenue, recognizing that the consumer demand was there and was either going to be filled by a regulated market or was going to be filled by an illicit market. And there were opportunities for new economic development, both from the business side and the tax generation side. And it might as well be done since consumers are going to be accessing the products anyway. The burden for achieving a patient registry card in Michigan is fairly low. You merely need to have a physician certify that you have a qualifying condition based on existing medical records. So we had at our peak almost 300,000 patients in Michigan out of a population of just under 10 million. That's only fallen to about 250,000 with legalized adult use. So we had what many refer to as a quasi-legal program already anyway, because almost anyone could achieve patient certification if they chose based on the qualifying conditions. Severe and chronic pain being two of the qualifying conditions that I believe almost 90% of the registered patients were having cited as at least one of their conditions qualifying them for access. So I think that's where the argument starts to be made that there is tax money that's not being derived from the program, even though the market is flourishing in the state. And the question then looms large: why not at least have it in a regulated environment where tax revenue can be generated, where there can be a regulatory agency that oversees the businesses and can ensure that it's not overrun by organized crime, and where safety standards can be imposed so that people who are getting access can at least be assured that it's as safe as possible.
You said, as I understood you, that when the medical marijuana program was operating, that there were 300,000 people with access out of a population of 10 million, which figures out to about 3%. Did I understand that correctly?
Correct.
There was a flurry. Go ahead.
Thank you, Mr. Brisboe. Let me ask you a question. I'm gonna go back and just clarify something I have here in my notes. Your tax rate was 6% for your sales tax for the state of Michigan, and then you had an additional 10% for marijuana. Is that all types of marijuana sales?
Correct. The way our tax law is written on the adult use side, so not the medical side, medical sales are exempt, but the adult use retailers are required to collect 10% excise on the sale price of any marijuana product that they sell. The 6% sales tax is then levied on the sale price plus the excise tax. So with that 1.5 billion or so in sales projected in fiscal 21, and our medical sales are still subject to sales tax. We're expecting revenue to be generated a little over 200 million in sales tax, in taxes overall, I should say.
Okay, well, going back to your overall number of 1.5 billion total, I think you gave us a number of that. Let me ask you, with respect to that 1.5 billion, that's all from retail sales, is that correct?
Correct.
Okay, and of that, how much of that is for municipal sales?
Projecting about a little over 500 million in medicinal sales, 970 in adult use sales. Projected this fiscal year.
Okay, great. And then on your municipal sales, can you give me a percentage of how much is sold in the form of flower versus other types of products?
I can. We publish monthly reports that we put on our website that actually breaks down sales by product type. If you give me a moment, I'll pull up our June report. So
I'm going to ask you about adult sales as well.
Sure. Give me just a moment and I'll do some math for you and I can tell you exactly what that is. So on the medical side in June, we had 20,666,000 in flower sales out of 41,653,000. So about 50%. Well, I'm sorry, that's just flower. I should include shake trim in that as well, as that is a flower product. Plus, so about 53.5% on the medical side is our latest numbers. That's flower. So that would leave 46.5% that's non-flower products, which would include concentrates, vape cartridges, and all manner of infused products. And then the adult use market was about 58% flower, 42% other products.
Great. Thank you, Mr. Chairman.
Thank you, Mr. Chairman. Thank you for being here today. I guess my question is more of an anecdotal. Do you have any information on how, since Michigan has adopted this, the impact it's had on the black market in your state and with other?
Yeah, it is a challenging question to answer because measuring the illicit market is something that's not very easily done. The anecdotal evidence, I would say, from the regulated side, from my perspective, is without a dramatic increase in the number of establishments that we've licensed, we've seen a dramatic increase in the products being sold. As I mentioned, our value of products being sold has increased tremendously over the past year, while retail prices have also started to decline. So that belies a dramatic increase in the volume of products being sold. So I think it's reasonable to presume that at least one aspect of that is that customers who were previously finding products through the illicit market have made a transition to the market. For example, looking at flower as a key indicator in the adult use market, the volume of flower sold between January of this year and June of this year has increased 208%. So there are certainly some new consumers that are coming to the market who previously probably did not consume cannabis products, but I think there are a number of others who are making the transition. At the same time, a industry group commissioned a study that recently indicated that by their analysis, about 2/3 of the market that's available is still outside the regulated market, either between the gray market, that which is potentially legally produced product, but not falling in line with full regulatory standards, and the truly illicit market still has that much of the market share. An economic analysis that we conducted several years ago, looking specifically at the adult use market, came to the conclusion that the overall market in Michigan for adult use was the ceiling of that was about $3 billion. So if we're on pace for close to $1 billion this year, I think that still indicates that there's a lot of market out there still being fulfilled within the illicit market. And one of our strategies from the regulatory perspective to combat that, and obviously there's a public health consideration, as I indicated before, we want to draw consumers in to find access in the safest way possible, is to provide the same level of access through regulated licensed businesses that consumers would typically have been gaining access in an illicit fashion. So we're very early on in adopting allowance sales locations to engage in delivery services, for example, so that consumers could get access to the regulated market.
Thank you.
Mr. Brisboe, we appreciate very much your time. I know that you have other responsibilities, but it has been very helpful to us for you to appear and have this frank discussion with us. You mentioned something about humidity that you wanted to mention before you left.
I think we may rival you in humidity, except that those of us in the north get used to the colder months. So when it hits us, we're not as accustomed to it. So I am probably perspiring just as much as anyone in your fine committee today. So I sympathize with your position.
Well, it's easy for you to say, but come down here in a few weeks. We can conduct an experiment and we can see how the humidity here compares to the humidity there. Thank you again. We really appreciate your time, and it's been very helpful to the committee. Thank you. Mr. Cedric Anderson and Mr. Roderick Woolard with the Mississippi Minority Cannabis Association have said they wanted to visit with us. So, gentlemen, if y'all will just come up to the podium and speak into the microphone, we'll be happy to hear what y'all have to say.
Well, thank you, Chairman Bryan. We appreciate the opportunity. Good afternoon. My name is Cedric Anderson. I'm a board member of the Mississippi Minority Cannabis Association. And joining me is Rod Woolard. He's a board member as well. We want to thank you for the opportunity to participate in this hearing. We have attempted to participate in the process even back when the initiative was in place. And here we are today, so we want to thank you for the opportunity. Senator MMCA, which is our organization, is building partnerships with some of the larger co-ops here in the state, with marketing and branding firms, as well as elected officials, to better understand what's needed in the communities most affected by policing policies of the past. Our process objective is simply to provide a structure by building supply chain connectivity, training, and education for those wishing to participate in the legal marijuana industry here in Mississippi. But our mission is to advocate for equal access for cannabis-related businesses, promote economic empowerment for Black and brown communities, and change those negatively affected by policing policies for cannabis. So let me walk you through what we consider an overt message for the need for self-reflection. Our goal is to get you there quickly. You should have a packet of documents that we provided in the green folder, and we'll discuss some of the points in there. Now, the market total for legal marijuana as projected by 2028 is $71 billion, with $14.8 billion by 2027 for medical marijuana. That's about 25% of the total market. The number of employees as of February of 2020 was 321,000 full-time employees. The projection for the end of this year is roughly 420 to 450,000 employees in the cannabis industry. So we've got employees out there, and it's a large number. But the question we have, or the problem we have, is that we have owners, and of those owners, only 10% of them are Black and brown. Well, this is indicative of social policies that really don't self-regulate. The licensees and workers should be reflective of the community. Now, I want you to take a look at this slide because I think it's very important. The proposed legislation that you guys are looking at must have a goal of creating a culture of equitable opportunity for all citizens and licensees, especially in this case. The effort to do so must be prospective, and that's a key word, perspective, in that the policy is forward-looking and focuses on policies that foster an inclusive and legal industry. The evaluation and implementation in most states do not consider retrospective efforts. And retrospective efforts, those are the efforts to reinvest in the communities disproportionately impacted. So those two components need to be in place in this case. The marijuana laws need to escape from the shadows of old policies, discriminatory policies, and implement programs that are inclusive, focus on community revitalization and human resource revitalization through education and training. So where's Mississippi? Where's Mississippi? Now, I've been to several meetings and I've listened to several meetings. And one of the questions that I really pondered for a while is, why haven't we addressed this issue or discussed this issue? Because at the end of the day, when we look at social equity, we're really talking about economic equity and what impact from an economic perspective we'll have on those communities. I kept hearing some questions about the Black market. We actually took a trip out on the West Coast about 2 weeks ago, just to take a look at their market. We talked to the mayor's marijuana czar. We've had discussions with some of the national leading guys on social equity and how to deal with social equity. And as we get a little further in the presentation, I think you'll understand some of the issues with how to implement those programs. But the other question is, whatever you put in place, what legal challenges and what costs would be there if the programs are not equitable and they're not fair? We kind of understand, the arrest rates and the imprisonment rates that we have up here. We understand, all those things. But here's what's important. State governments are recognizing these things when they implement these programs. I think Mississippi has to be one of those states that does the same thing. So it's very important that we consider the retro aspect or the retro efforts as well. So senators, in the packet that you have, MMCA provided a summary of several states. We looked at several states, and we wanted to see how they were implementing these social programs, these equity programs. And you have an opportunity to read that at your pleasure. But I want to talk quickly about 3 programs, just 3 states. And for lack of a better term, and humor me on this one, I call it the good, the okay, and the ugly. So I want to start with the ugly. On our trip to California, we got to see some things that were very challenging to us. We walked through some grow houses. We got to see some things happening right in front of us. We saw transactions take place right in front of us at a lunch table. And it was somewhat alarming to us because we considered the Wild Wild West at that point, because we saw guys walking around with duffel bags full of marijuana. We saw guys coming up with samples in backpacks, but transactions were being done right there in front of us. But it was a legal transaction. It's a mess. California was a mess. It has a dual permitting system. Each city is responsible for dealing with social equity. LA is a tiered fee system. It welcomed financial unstable individuals. Their social equity program brought in felons. They gifted them through their program licenses. I think they're dealing with that to this day. So in our discussions with their czar of equity, of policy, that was one of the things that she was trying to correct. Their taxes, roughly about 40 to 45%. So what we've seen is that 70% of the state marijuana is black market marijuana. So we want to make sure that we put things in place that doesn't stimulate California. Okay, so let's look at the okay. We look at the ugly, let's look at the okay. The okay to us is Oklahoma. It's a wide open state. They tried to indirectly address the issues through low fees and unlimited licenses. It worked. It worked. They got the diverse applicant pool that was proactive. That was a proactive effort. It worked. They got the pool. So it's had some impact. The black and brown applicants got an opportunity to participate. But as I stated, the successful approach has to have a retrospect effort. You have to look back and revisit some of the problems. And the effort needs to be robust and purposeful. These are several state approaches that have been successful leaps in the social and economic equity arena. But there's something even better. And today, Illinois is probably the best example by far of social equity programs in the nation. Why? Well, under the guidelines, it takes into consideration several factors, including community resource, marijuana policing, in the applicant's community. So they actually look in the community and they grade based on that. The applicant workforce utilization from drug-affected areas, that counts. The tax provisions are utilized to improve economic development in hard-hit areas. They even provide cannabis business loans, a major breakthrough. But not included here, let me get you to the right slide. Not included here is the fact that they actually have implemented technical assistance and business training programs. with the goal that every business will be successful. This is an excellent example of a proactive and retroactive effort. So what I say to you today is don't ignore the issues. As ironic as it sounds, listen to the data. Value the experience of the other states. And please don't follow California. Please don't follow California. So with that said, I'll turn it over to Rob Willard and he can talk about what the legislation was achieved.
Chairman Bryan, co-chair, Parker, and committee members. I had this nice little speech prepared here today for you, but I'm going to deviate from that for a reason, because I want to put a face to this opportunity. And that's all this is an opportunity for Mississippi to do something for all the residents of Mississippi. We talk about the war on drugs. That's just a sound bite unless you live in that community, unless you know of people who've been incarcerated for selling drugs, and unless you know of families that's been affected by their son or their husband going to jail. It's just a sound bite. So today, let me ask you this. Here's an opportunity for us to correct a whole segment. One while in Mississippi, we were the richest state in this country through cotton. Cotton was king. Well, there are a couple of things coming. Medical marijuana is here. It's just a matter of you guys putting it together. How are you going to roll it out? Everybody that we talked to talked about recreation marijuana coming right behind it. Then there's another elephant in the room. When the federal government finally schedules this, move this drug from a Schedule I drug, it's going to open it up state to state. It's going to be interstate commerce. So if we don't put Mississippians in place now to take advantage of this, then later on it's going to be harder. So my only request to you today is, as you look at this, as you go through it, please remember that this is an opportunity for all Mississippians. I listened to something when the hearings were being done through the health department, and they asked some business owners from Oklahoma to come. They stated that on the day that they passed the initiative, that a group had come together that day and put $25 million together to invest in this arena, in this industry. People, this is a business, and we may as well treat it like one, and let's try to get everybody. And we have some of the best farmers in the United States right here in Mississippi. Let's figure out a way to get them to the table. Let's figure out a way to get everybody a piece of this pie before it's too late and it's all delved out. Thank you for your time. Chairman, I appreciate you allowing us to come. Are there any questions?
Do members have any questions for either Mr. Anderson or Mr. Willard? If not, we appreciate y'all coming to talk to us, and we have the information you've left with us. We appreciate that, and I assume we'll post this on our website unless there's some objection.
Thank you, Chair.
Thank you. We appreciate your time. We have Ms. Jessica Rice, Executive Director of the Mississippi Cannabis Trade Association, who wishes to speak to us. Ms. Rice, if you'll just come up to the podium and be sure and speak into the microphone, and we're happy to hear what you have to tell us.
Good afternoon. My name is Jessica Rice, and I am the Executive Director of the Mississippi Cannabis Trade Association. Thank you to Senator Blackwell for inviting me here today. Thank you to the chairman for holding these committees. And thank you to the committee for being here and demonstrating your commitment to the citizens of Mississippi to start a medical marijuana program. As well as a special thank you to the governor and the lieutenant governor and the speaker of the House for giving attention to these issues that so many Mississippians care about. I'm here today on behalf of the Mississippi Cannabis Trade Association. We were founded in November of 2020, just days after the November 3rd election, in which a majority of Mississippians voted in favor of Initiative 65. I, along with 5 other Mississippians, decided to gather together to create a new kind of trade association in the state. We wanted to cross age, race, and political parties to uplift Mississippians in a way that could bring patient care and also economic development to the state. Our purpose is to promote a responsible and legitimate cannabis industry in the state of Mississippi and shift the paradigm of cannabis away from the approach of controlling an illegal narcotic to one that is developing an agricultural commodity and developing a space for medical innovation. We are nationally affiliated with the American Trade Association of Cannabis and Hemp, which has members in 35 states. And locally, we have over 300 members from all across the state of Mississippi who have joined the association. Our 3 ways that we want to create and foster the cannabis industry in the state are through advocacy, education, and community. We aim to serve Mississippians by acting as a resource to not only the general public, but also to regulatory bodies and policymakers. I come to you today to fulfill that last promise. I, by trade, am an attorney, a product of the Mississippi public school system. I ended my career at the University of Mississippi, where I received my law degree. After graduating from Ole Miss, I worked with the Secretary Dick Mulpus in combating brain drain in the state, as well as clerking for our state's Court of Appeals and practicing law here in Jackson. I now own my own firm, but previous to that, I worked with the cannabis law division in my old firm. I did research and helped a lot of different states in the beginning formation stages of their legalization process. I'm very excited to be able to bring that knowledge and that research to my home state. I noticed that there were a lot of positives that came out of legalizing cannabis, whether it was for adult use or medical use in those states. There was additional treatment options for patients in medicinal states, as well as economic growth for local communities, job creation in rural areas, and the creation of a new and significant avenue for revenue, for tax revenue for the state. The MSCTA's goal is to ensure that we have a quality medical program for patients, as well as providing economic opportunities and benefits to all Mississippians. Quality testing facilities and clear regulations are the way that we can achieve that together. Additionally, the cannabis legal market has provided over 321,000 new jobs in this country. Specifically in 2020, even during the pandemic, when there was a loss of jobs in many industries, the cannabis industry created 77,000 new jobs. This is a great opportunity for Mississippians to remain in the state and to add an additional avenue of revenue to their already existing businesses through ancillary businesses and also creation of new jobs far as cultivating, manufacturing, processing, and testing facilities, and the such. We expect there to be thousands of new jobs created in Mississippi and would like to help foster the knowledge and education needed to ensure that we have a quality medical program and the individuals who are working in that program are knowledgeable about cannabis and about the way it needs to be cultivated and dispensed in a legal market. Additionally, as many people have mentioned, that federal deregulation is coming. And this is a great way for Mississippians to be put first. By having an opportunity to develop their businesses in a state market, they can use those resources to ensure that they are successful in a national market. As a young Mississippian, I'm very passionate about staying here in the state and also retaining our youth. I believe the cannabis industry is one way that we can ensure that. It creates new jobs, it adds additional resources to jobs that already exist, and it is an interesting market. Thank you for allowing me the chance to speak. Please let me know if you have any questions. Myself and the MSCTA would like to serve as a resource during this process.
Thank you. Are there questions? Senator Blackman.
Thank you, Mr. Chairman. Attorney Rice, I believe you said that at whatever law firm you were at, that you did research for cannabis legislation in other states. Did I hear you correctly?
That's correct. The firm that I was at had 12 offices in various states, and I was a part of the cannabis law group and helped them do research as they prepare to bring in the adult use market in New Jersey and also develop legislation and how to interpret the laws in other states.
Did you have occasion to do any medical research in the medical marijuana field?
Yes, ma'am. So since my time then, I have completed a lot of research on medical markets, as well as just using that research to pass along to some of the states like Illinois and Pennsylvania.
And I guess the conditions that we are identifying for the use of medical marijuana, were those some of the same conditions that you found for these through your medical research?
That's correct. The list of qualifying conditions that was detailed in Initiative 65 was representative of most of the qualifications that you had to have in other states.
And when you were researching medical marijuana, the growing of marijuana, did you find the states, whether they grew it in house or in fields?
So yes, ma'am, they had both indoor hybrid, which is a greenhouse, or outdoor. Many states, lean towards indoor and hybrid because it is a more controlled environment. However, some states do, of course, offer outdoor.
Well, when you were talking, you mentioned something about job creation in rural areas. So I was so was that in-house growing of marijuana, or was that like in where those, where they have the tobacco leaves and all of these tobacco growing states where all of the farmers just have their product as tobacco?
That's correct. In rural areas, they were a bit, depending on the state and what their rules and regulations were, those folks were able to utilize either indoor, outdoor, or hybrid.
And I presume, since you were talking about job creation in rural areas, that there was, I guess, not a financial impediment to getting a license for, whether you're a processor, grower, or things of that nature?
Well, the licensing fees, among the different states vary. And that is one thing our organization appreciated about Initiative 65 was that it stated reasonable fees, for Mississippians. And that's something that we would like to see continued in any pending legislation. Sorry. I do a lot of
I
litigating, so
understand. Thank you so much, Attorney Rice.
thank you.
Other questions? If not, thank you. Make sure that,
I think he had a
oh,
question.
I'm sorry.
You sure?
I'm sorry. Please make sure that we have your contact information. Make sure the committee assistant has that, please.
Will do.
And thank you. We appreciate your time. We appreciate your coming. I do not intend to call any additional hearings. I think that the hearings we've had have been productive. Just speaking for myself, I think that I have gotten something out of every single presentation at every single hearing, which is a pretty good track record. And at this point, I understand Senator Blackwell is working on some legislation. And I assume at some point we'll be all gathered together to discuss that legislation. So if there's nothing else, we'll stand adjourned.
Chairman, do we have an indication of our friends on the other side of the Capitol where they are on this?
I think that there are conversations taking place. I think I'm more enthusiastic about having public hearings than some are. But one of the goals I had in having the public hearing was simply to sort of flesh out the issues and have some public conversation about that. I think that's taken place. And, there are House members here today and House members here previously. So the conversations are going on. The conversations are going on informally. I know that individual members are having discussions with the House. And I assume that discussions are going on among the Speaker and the Lieutenant Governor. But as far as any specifics about that, I don't have any additional information other than what I hear, which I assume is what you hear.
Thank you.
Thank you. We stand adjourned.